Our professional this week is Dr. Bulumko Poswayo. Dr. Poswayo is originally from South Africa in the Eastern Cape. He is a qualified dentist and was previously working as a clinical nurse in a hospital. He talks us through his career journey and shares how he discovered nursing and dentistry. His career story is very unique in that he shows us how he pivoted into a different career once he learned a bit more about the health sciences field and the different careers that they offer. He encourages young people to do their research early into prospective careers and that they should choose careers that they are passionate about. If you like this video, remember to hit the like button and subscribe so you don't miss out on our amazing series. Remember to share with your friends, as this could be helpful to them as well.
Hello, my name is Dr. Bulumko Poswayo and I'm 32 years old. I was born in a small village called Nganabana location, situated in a small town called Ngcobo in the Eastern Cape, South Africa. Nganabana location is a poverty-stricken area as majority of people are unemployed and are living on hand-to-mouth. Some people live in mud houses which could sadly collapse at any given time. I work as a dentist and I've been working for almost 6 months now. Growing up in a village and living under poor conditions, I always strived to escape poverty. I did not know what I wanted to become because, I did not have much exposure to things. Deep down, I wanted to be a successful soccer player who would play for the national team. Unbelievably so, I completed my high school without having any idea of what I wanted to become. In 2011, I enrolled as a nurse and I completed it in 2014. Needless to say, I did not enjoy it because I switched to dentistry after a friend of mine was admitted to University of Pretoria for dentistry in 2016. She encouraged me to apply for dentistry. I had never in my wildest dreams thought I would become a dentist. I did my research about the course and I fell in love with it because it is about bringing smiles to people's face, something I am passionate about. I attended my high school at Nyanga Senior Secondary School in Ngcobo, just along R61. I did maths and science subjects. It was not by choice. In my time, we did not have career guidance programs. Well, at least not in the school at which I was attending. A teacher came to our class and took a fair number of students to maths and science class because our class had so many learners. I happened to be among the learners who were taken to the science class, and that is how I ended up doing maths and science. Funny, right? My top 3 subjects were life sciences, physical sciences, and geography. Life sciences, physical sciences, maths helped me after matric because health science courses require these subjects. If any learner wants to pursue a career in health sciences, he or she must try to obtain good grades in the above-mentioned subjects. After high school, I enrolled in Bachelor of Nursing from 2011 to 2014 at Walter Sisulu University in Mthatha, Eastern Cape. Many of us in the Black community who could not afford fees were enrolled with this university. Fortunately, I was among the 20 students in class who were awarded a bursary based on matric results. The courses I did were biophysics, biochemistry, physiology, human anatomy, midwifery, psychiatry, and general nursing sciences, among others. After completing my degree in 2014, I worked as a registered nurse for 4 years, from 2015 to 2018. In 2019, I enrolled in Bachelor of Dental Surgery, of which I did chemistry, human anatomy and physiology, oral biology, and major courses which are maxillofacial surgery, prosthodontics, periodontics, orthodontics, restorative dentistry, pediatric dentistry, general and oral pathology, and oral and maxillofacial radiology. This was a very challenging degree for me, but what helped me through was studying in groups, going through past papers, consulting with lecturers, watching YouTube videos, because dentistry is more clinical. I was so lucky to be awarded a bursary from second year to pay for my fees. In first year, I paid my fees with some of the savings from nursing. Like I mentioned earlier, I work as a dentist. My job entails consultation and oral screening and devising treatment plans based on the needs of the patient. I have a wide range of scope of practice, including simple tasks like tooth extraction, scale and polish, fluoride treatment, oral health education, taking intraoral and extraoral radiographs, to more complex procedures like crown and bridge, veneers, dentures, applying fixed and removable orthodontic appliances, pediatric dentistry, taking biopsies, treating odontogenic infections, and many more. The area in which I am currently working is in the deep rural areas of the Eastern Cape, where people cannot afford private hospitals and practices due to their low socioeconomic status. I currently work in a primary hospital with a dental unit. On a rough day, we see about 45 patients from the age of 3 years going up. During weekdays, I wake up at 6:30 a.m. and take a bath. When I'm done, I go select which scrub top I'm going to wear, a task I hate, by the way. I iron my clothes in the morning because luckily I stay within the hospital premises, and then have my breakfast while I watch some dental YouTube videos or some house music videos because in my leisure time I DJ. At 7:50 a.m. I drive to work. When I get to work, I prepare my patients for the procedure they came for. Each procedure can range between 10 minutes to 60 minutes depending on the type. Sometimes I lose track of time due to the amount of work and miss my lunchtime. After work, I hit gym. I have my mini gym in the garage. After my supper, I revise some topics I came across at work or just revise some work I learned in dental school just to keep my knowledge up to date. Then I take a break and DJ, trying out some new songs. What I like about my career is bringing smiles to people's faces. Smiles that help restore their confidence. You know that moment when a patient tells you he or she cannot smile in front of people anymore, or he or she cannot apply for that dream job because of how his or her teeth look? Then you come and change their life for the better. That feeling is unmatched. I also like helping people get rid of the pain. Tooth pain is one of the worst experiences a patient can ever have. Everything just stops. You cannot function when you have tooth pain. That feeling of being in a position to help eliminate the pain and help the patient walk out of your door pain-free is priceless. It always makes me feel like I've conquered the world. What I don't like about my profession is telling the patient that the only option left is to extract the tooth. That is devastating because my job as a dentist is to save teeth, not pull them out. My profession is everything I wanted and more. Good paying and the working hours are flexible. Previously, when I was still a nurse, I would work night shifts and weekends. As a dentist, I don't work on weekends or public holidays. I don't do night shifts. Dentists in South Africa earn between 45,000 and 75,000 depending on where you are working and your grade progression. With my first paycheck, I spoiled my daughter and bought a few things at home. And I paid my first car installment. My biggest dream in my career is to become a dentist who is popular for being the best at his work in terms of the treatment I provide and treating patients with love, kindness, and respect, irrespective of socio-economic status, race, level of education, gender, or religion. To everyone still deciding on what career option to pursue, think carefully. Do something you love and passionate about. Do not follow a career because it looks cool and matches your lifestyle. If you don't have a passion for it, you will not be able to keep up with it. You will wake up every day unmotivated to go to work and ultimately productivity will drop. Work hard to achieve your goals. At the end of the day, it won't matter how long it took you to do it. What will matter is that you did it. It took me 9 good years post-matric to become something I'm really passionate about. As they say, dreams delayed are not dreams denied. Do your research if you are not sure. I wish you all the best. Thank you and goodbye. Dr. Poswayo.